HIV program that focuses on core issues by Brittany Burton. Nationally, 115 people die a day from opioid use. In 2015, an unexpected number of people were newly diagnosed with HIV. This number rose due to the current use of syringes and syringe sharing. The CDC and NHI and Indiana Surveillance of HIV have reported an expected rise in this population of people for the year 2019. Programs were applied too late, allowing the opioid epidemic to take over communities and allowed for an increasing amount of new HIV victims. These victims include women, men, and newborns. Creating a program that intervenes before a crisis happens is what communities want and need. Why wait for a crisis when a crisis can be prevented? The HIV program that focuses on core issues will include intervention, prevention, and treatment. This program will also provide services to victims who have contracted HIV from syringe use. The community needs assessments and struggles to keep this population maintained due to lack of preventative services. The population struggles with accessibility for treatment. By creating focus groups that will survey the community need, the population need, and the political need, this will create data on what population's risks, needs, and safety will be required for the program to provide services. The program will use data to utilize the most appropriate locations to provide services that are accessible to the community and concerns. The community concerns are overwhelming with the amount of calls to first responders due to the drug use and due to public health safety. The community fears that Hep A and HIV will increase and become much larger issue in the future to maintain. Population of focus concerns are concerned about having accessibility to treatment, intervention, and programs that provide adequate help. Current organizations fear this population will grow and the funding will not be available. What is the problem, and why are these issues expected to increase and not decrease? Programs like the needle exchange are not applied to communities until there is a crisis of HIV or hepatitis. The HIV program that focuses on core issues will be applied to communities that are already suffering from high rates of opioid use with little to no intervention. The program will treat, intervene, and prevent the spread of HIV through syringe use by applying services before an HIV crisis or hepatitis crisis happens. Funding. Where will the funding come from? Funding will come from local events, programs, and state and federal grants. Contractors such as LARC will contribute to the program by applying education and the supplies for safe sex. LARC will educate clients on what safe sex is. LARC believes that contraception such as birth control is great, but it does not prevent the spread of STIs or STDs. LARC will educate and provide male and female condoms that will actually prevent the spread of STDs. The Monroe County Syringe Disposal Box Program will provide syringe boxes to organizations and bikes to clients. The syringe boxes provide a safe place to put used syringes throughout the community. The bikes provide access to the boxes for the population of focus. Glidea for Truvada provides coverage to both client and staff for medication that can prevent HIV. This coverage will cover whatever copay is not covered or a portion of medication. PAN will provide the remaining funds that Glidea is not able to cover for Truvada. GISA is a program that only works with nonprofits, and it has services such as bookkeeping, legal advice, tax advice, and all these programs are little to no cost. Staffing has been figured out by the current wages and salary paid yearly for full-time and part-time professionals. All staff on this budget are required to have degrees, experience, and references. The psychiatrist and trainer are the only two positions that are part-time on this budget. Social workers, supervisors, and job requirements are to schedule staffing clients and maintain paperwork. Social worker managers are required to maintain paperwork, give instruction on preventative care, interventions, and treatment plans. Psychiatrists will work with the most high risk suffering from HIV, substance abuse, mental health illness, and other issues. Psychologists will give assessments to determine what type of prevention plans and treatment are necessary. Support staff will carry and give transportation to therapies, doctor's offices, appointments, treatment, and other types of intervention in the community. Support staff will also provide supervision for children so clients can be successful and not worry about the financial costs of child care and can focus on treatment. Trainers will provide public health training on safety, HIV, CPI to reduce the costs and risks of clients and staff. The program will focus on current organizations and health facilities to team up by teaming up with these other facilities like IU Health, Indiana University, and the Board of Health. We hope to gain knowledge, save on expenses, advertisement, and use open spaces to provide services to the population. Advertisement will consist of using local resources, websites, audio. Advertisement is low and the cost will be effective using cheaper resources such as radio and websites. Printing will only be used for pamphlets to provide more advertisement throughout Monroe County. Risk management is taken seriously for this population of people and clients. Insurance policies for both physical property are for both physical and property. They are included to cover the transportation, physical injury, and medications. Truvada is separate count funding to provide a client or staff who may not be eligible for PAN or Glydia. The 503 forms are required by state law and will be filed appropriately by a lawyer. The HIV program that focuses on core issues wants to prevent a crisis before a crisis happens. This is done by recognizing areas that have high rates of opioid use. Using a program that intervenes before a crisis will prevent the newly diagnoses of HIV victims in 2019. The program will utilize current prevention plans, intervention, and treatment. Getting politicians on board and advocating for the use of funding of programs like the HIV program will prevent the spread of HIV in communities that suffer from high opioid addiction. Contact your local representative and tell them to support and fund and advocate for programs that prevent the spread of HIV to men, women, and newborns.